afterward.
And maybe we should start.
Yeah, that sounds good.
Okay. So I'm David Tuller. I am at Berkeley at the School of Public Health. I'm a senior fellow in public health and journalism at the Center for Global Public Health, which is part of the School of Public Health. And I have written a lot over the years about ME/CFS research and also more recently about long COVID. And so I'm really happy to help have this event or this conversation, which is part of the rollout of the long COVID survival guide, which is a kind of handbook or a kind of compendium of chapters written by different people involved in long COVID, mostly, I guess, all patients, or I guess a couple of researchers, non-patient researchers as well. But anyway, so I would just want to give my three guests just an opportunity to quickly introduce themselves, and then we'll start talking about the book. So Fiona, why don't I hand it over to you first?
Sure. Thanks, David. So I'm Fiona. I am the editor of the Long COVID Survival Guide, which you'll see in the background there. And I'm an independent journalist and speaker and consultant. I am also the founder of Body Politic and the co-founder of the Body Politic COVID-19 support group. I no longer run that group. It's run by the incredible Angela Vasquez and many other people. But I started that group in 2020, and that was kind of the way that I connected with a lot of other people with long COVID. I've spent the past 2+ years, however long it's been since I got sick, writing a lot about long COVID. And that has, of course, led me into related illnesses like ME/CFS and dysautonomia. And so a lot of my work focuses on disability and chronic illness, as well as LGBTQ+ issues. And before that, I tended to look at kind of the intersections of wellness and social justice. So that was, of course, a ripe topic to lead me here. So yeah, that's a little bit about me. I guess I'll turn it over to Lisa. Do you want to introduce yourself?
Sure. So I'm Lisa McCorkell. I am one of the co-founders of the Patient-Led Research Collaborative, which is a group that formed out of the Body Politic COVID-19 support group, and is a group of long COVID patients who conducted the first research on long COVID, and we continue to conduct research, do advocacy, and now we're actually funding research into long COVID and associated conditions. Prior to this, I was in public policy. So I have a master's in public policy from Berkeley. So we have the Cal connection with David. Yep. And after I got my graduate degree, was working for the state of California on SNAP policy or food stamp policy, and doing the PLRC work on the side when I could. And then in May went full-time with PLRC. So continue
PLRC, just to be clear, is Patient-Led Research Coalition.
Collaborative, Patient-Led Research Collaborative. Yep. And I have had long COVID since March of 2020. And in the book, I wrote a chapter on navigating research, which was very topical given Patient-Led Research Collaborative's work, and was really awesome to share some of the learnings that I've had over the last 2.5 years.
Okay, thanks, Lisa. And Padma, why don't you explain your involvement?
Hi, everyone. My name is Padma Priya. I'm from India, Hyderabad, India. I'm a journalist too, like Fiona. And so in my previous life, before long COVID, I was a full-time, media entrepreneur, just running a growing podcast platform network here called Suno India, which basically means Lizard India. And we were covering a lot of issues which we feel were underreported. I mean, that's part of something that I continue to do, of course. But I also am a long COVID advocate from India, and I've written a chapter on peer support and why that is important. I've also been a health journalist before starting my own company. I've been in the public health advocacy space, where I work with Doctors Without Borders South Asia here. So yeah, that's my connection to public health and writing. So yeah, I'm glad to have contributed a chapter.
Thank you, all three of you. I actually want to start off before we get to the book. I was just wanting to start off something that was topical that Fiona and I were on a panel last week about, although we didn't get to discuss it much. The New York Magazine recently had a very long article about long COVID and MECFS, which basically took the position of those who suggest that these things are largely psychogenic or sociogenic or really kind of manifestations of anxiety and depression and so on, things related to possibly the pandemic, but not necessarily related to any pathophysiological processes going on besides perhaps deconditioning. And so a lot of the thrust of the article seemed to be a challenge to the notion of patients being involved in research or patients constructing their own concepts of what illnesses they have, or patients somehow anyway, it seemed to be that patients, the suggestion seemed to be patients were running an end run in some ways around sort of established procedures, and that this was sort of a bad thing rather than a good thing, perhaps. And so I'm wondering how, in terms of what you've all been involved with, how that article, if you read it, struck you, and what your reaction to that presentation of patient-led research was. And maybe Fiona, since you were initially involved in body politics from the beginning, maybe you can start with that.
Yeah, I mean, I think one thing that struck me about that article was actually the attempt to create this firm distinction between patients and people with lived experience and experts, to such an extent that actually the description of you, David, in the article was sort of unclear whether or not you yourself were a patient or a journalist. Like it actually, the way that it was written, I would have perhaps perceived you as someone with MECFS, which
it called me an academic at Berkeley, but as I pointed out, I could have been an academic in finished literature that had nothing to do with public health. So it sort of obscured my professional expertise in terms of my ability to talk about the epidemiology. But I was just struck by the attitude towards patients being involved, that this was somehow a bad thing.
Yeah, I mean, I think it really accepted this framework that there is this hard and fast distinction between patients and, scientific and medical experts, both in the sense of patients, in terms of accepting the idea that patient-led advocacy efforts are not science-based, which, especially in the case of, what the article was discussing, which was graded exercise therapy and cognitive behavioral therapy as treatments for MECFS and long COVID, as you well know, David, the patient efforts there were very much interrogating the science and going through the research and, interrogating the methodology of those studies, right? It was absolutely not saying, well, we don't want to be labeled as mentally ill. And that's something that I think—
Right, that's a total misrepresentation. And the patients were on top of were the ones challenging the research before I got involved, or before anybody got involved who was outside the patient community. So they were the ones really on top of that with the PACE trial anyway, and the MECFS research.
Absolutely. Yeah, I think it's one of many articles, maybe not many, but it's one of several articles we've seen that have kind of taken this stance throughout the pandemic. And it's not entirely surprising, but I think it was a little surprising to me to see something like that at this stage in the game, especially when you have— right, we're at the point where we literally have a book written by patients, right? We started with, kind of blog posts and anecdotes from support groups. And then, I was writing op-eds in the New York Times, and we had other people writing articles and, patients being quoted. And now there's quite a lot of people that you can speak to with the lived experience, and quite a lot of people like Lisa and Padma who have been involved in, doing the research or participating in the research as patients. So it was disappointing that those sources weren't quoted, but I'm curious to hear others' thoughts as well.
Well, Padma, I'm curious if that kind of something in New York Magazine, which is well known in the U.S., not necessarily elsewhere, if that penetrates in people reading in India, and sort of how that impacts things over there.
Yeah, thank you, David, for asking that, because that's what I wanted to actually chime in about, because when articles are written in the New York Times or the Guardian or the New York Magazine or the New Yorker, for example, these are picked up by experts. I'm sorry, I'm doing the quotes, but by experts in other parts of the world, like say in India, and then who go on to berate patients on social media using that article as a base. So I actually experienced that people are using doctors, MDs, using that article to say, see, we were right all along, because prior to that article, I'd got into a very public spat with a couple of doctors who were calling us a cult. They said we are all a cult of long, long COVID patients or so-called patients. Yeah, a cult who don't want to recover apparently, and who just want to live in the COVID world and who don't want to believe that COVID has gone or something like that. And so it was pretty pretty maddening and disheartening at the same time to hear that from a doctor. So articles like this actually damage a lot in other parts of the world, because in LMICs, a lot of the research is also driven is coming in from or knowledge is coming in from the other countries, from the developed nations, right? So we have this whole divide. There is, even in terms of global health equity, there is a divide in how resources and knowledge is shared. And when these kind of articles are written, it has a direct impact on how patients are actually treated. Because there is already so much of medical gaslighting happening here. And then we have articles like this, which are then, doctors just say, see, this is what we were saying all along, it's all in your head. So I think it can be very, very damaging for patients themselves.
Okay, thanks and Lisa, how about you with your focus on research? Did you read that article, and what was your take on its sort of approach to patients' involvement in research?
Yeah, I mean, it was very frustrating and angered me a lot, but I wasn't that surprised based off of interactions I've had with many researchers, especially some in the Recover Initiative. I think that type of viewpoint is fairly prevalent in academia, and that's
the viewpoint
really
about patient involvement specifically, you mean?
Right. Yeah. Just a devaluing of patient experience. And it really, I don't entirely know the motivation behind it, because we'll get to answers faster. We'll get to better outcomes for patients if we are valuing the patient experience and valuing what patients have to say. And I think, a large proportion of people have viewed what has happened over the last 2.5 years with long COVID as a really beneficial thing, that patients have come together, have been at the forefront of a lot of the research and have been advocating. And so I think some people do see that, but there's still this mindset that really just devalues patient experience and doesn't think that patients are the ones who know their body the best, and that we are motivated to find answers that will work. And that doesn't matter what those answers are. We just know what's not going to work. And so that's what we're fighting against. So I don't know. It's just really frustrating to see that type of article come out, because it's, we're desperate for answers and real answers,
So, okay, let's turn to the book. And so I guess, Fiona, what was the impetus for it? I mean, how did the idea of it come about, and how did you sort of end up having it be this particular format? And how would you, I guess, differentiate it from Ryan Pryor's book, which has come out at around the same time? Which, hopefully even you're friendly, you're both serving a similar purpose to try to inform people. And I mean, I think the pub dates were almost coinciding pretty much.
Yeah. So Ryan's book definitely tells part of the story of how some of the contributors of our book met. Definitely tells part of the story of how Lisa and I met. And so Ryan's book is, I think, provides a lot of that kind of historical context of, what is the relationship between ME/CFS and long COVID?
So that's Ryan Pryor's book. He's a journalist in Atlanta. He's worked for CNN, and it's called The Long Haul.
Yeah.
And it's just out this month as well.
Yeah. I believe it published last week. Long COVID survival guide is, a little bit more advice oriented, right? Ryan's book is not necessarily aiming to give patients the advice to kind of navigate an illness, but more so the story of kind of how we got to where we are.
It's a book of narrative. It's a narrative book about the sort of the history of the long COVID and how it ties into stuff. It's not a guide with multiple authors say.
So I think they're excellent companion books. And I think Ryan's book is also, I'm only about a third of the way through, but strikes me as a great book as well to give to friends and family who are trying to understand this disease. Although, I hope our book can be that as well. Basically, the way this book came together, I was approached a couple times about writing, about my own experience with long COVID. And I just felt like a guidebook to long COVID can't really be authored by one person, both because the symptom presentations are diverse. And, long COVID is an umbrella term that encompasses, a lot of different experiences, but also because your experience varies dramatically based on when and where you got sick, who you are, what the situation was when you tried to access care. And so I really wanted to bring in as many different contributors as possible who could try and represent that diversity of experiences. And so I think both with Padma, Priya, and with Lisa, both of them had, had these, I think the book, I'll start by saying, I think the book also has a couple different goals. And one is to provide that kind of emotional support that the three of us found in support groups, like Body Politic and like the support group that Padma Priya created. But I think also to provide that logistical advice of, these are compression socks and, they can help with these symptoms. And this is, this type of medication that you can ask your doctor about. But then I think finally to kind of bear witness to just what we all experienced and to really tell our own history. And so both Lisa and Padma Priya really played a major role in this history. With Lisa, right, it was the founding of the Patient-Led Research Collaborative, and Lisa's chapter aims to arm patients with the tools to understand emerging research, because this is a book, it can't account for all the research that is going to come, that is a moving target. And Padma Priya, living where she lived, experienced some of the most devastating waves of this pandemic outside of the United States, and created the type of community care that I think this book is all about. And so her experience as well, for me, I wanted to really tie that link between where there's a big acute wave of COVID, there is also likely a big long COVID wave. And I think Padma Priya's chapter really speaks to that as well. So that was part of the reason, I reached out to these two people in particular, but in general, it felt like this whole movement was so collective and collaborative. And this experience is one that has touched so many different types of people that a collaborative effort was what the book required.
And one of the things also, it sort of struck me in, I think maybe one of the first times we talked was after or around the time of the Jeremy Devine article in the Wall Street Journal, where he talked about just what you're talking about as a positive, that this was started by a queer feminist collective. He sort of included that phrase in there as if automatically anybody who read it would automatically somehow agree how shocking it was that a queer feminist collective was somehow involved in doing any research at all. And so it's interesting just to hear you describe it in the positive way, which is the way one normally might want to think about it, when it seems to be used just as a knee-jerk way to elicit a negative response. And I'm wondering why you think that is. Why even is that?
Well, I think it just depends on kind of your approach to these topics. I sometimes joke that, this book, you'll see my copy here is all marked up, but this book, we have a graphic novel style chapter on menstrual issues. This book is in many ways a feminist zine in disguise. And that is kind of the politics that I was raised with, both at home in terms of, who I was exposed to in my early childhood, and in terms of kind of the political organizations that shaped me when I was in college and when I was studying journalism and, creating publications with my friends and that sort of thing. And so that was the framework that I brought to this work. That's what Body Politic was. And that was the organization that was there that we were all using to respond to this crisis. And it's not the first time in history that people have used a kind of explicitly political organization to do critical health organizing work, right? We saw that with HIV/AIDS, certainly. And, we saw that with the women's health movement of the 1970s, and also with groups like the Young Lords and the Black Panther Party. And so I talk about that in my introduction, kind of going back through the relics of my history major, some of the papers and syllabi and documents that I had read as an undergrad in college, and looking at them with new eyes after getting sick and forming the support group and realizing, in some ways, this feels like a really radical new path that we're like carving out ourselves. But in other ways, it is actually a path that people have been creating for as long as there have been groups that have been neglected by mainstream medicine and science.
And how would you compare it to what, in thinking about, I mean, having read about ACT UP and so on, and since I'm 66, I was coming out in those years and after college and late 70s and early 80s, so I remember those years very well. How do you see, and either one of you also can chime in on this as well, how do you see the activism you're doing now compared to what ACT UP was doing, or similarities and any differences?
I mean, I think that I'd be really curious to hear from both of you on this, but I think that the pushes that are happening right now around, wanting specific clinical trials to take place, for example, with Paxlovid, feels very similar to, some of the pushes that were happening in the 80s and 90s, where patients were saying, certain drugs weren't working for them, the side effects are too intense, or, we need to be trying, a different route here, and really honoring that lived experience and kind of letting that lead the research agenda. I know that's something that patient-led research takes really seriously. For me, I think a lot, as a journalist and a communicator, just about information sharing. And so stories of, the gay men's health crisis hotlines where people were answering phones and giving each other information. That's the sort of thing that I think the body politics support group and Padma Priya's support group provides people with, the validation and kind of that first arm of information where you're getting the basic tools to understand where to go next. And that's, I think, what I hope this book would be too. That kind of pamphlet that you might have gotten back then, at your doorstep, which, by the way, is still needed for HIV and is not funded in the way it was at a certain point. But that's what kind of occurs to me. But I'm curious to hear others' thoughts.
Well, yeah, Lisa.
Yeah, I was just going to say, I think, we've had a lot of progress because ACT UP came before us and made a lot of those inroads with NIH and made it more normalized to have patient engagement and to, to rely on the patient experience. So we've had, I think, more inroads, more opportunities to meet with government officials because of the work in the 80s and 90s to do that. And I think, especially like with patient-led research collaborative, a lot of our, especially early work, is modeled a lot after the treatment action group, and kind of like when there was no information, no research at the time being done on long COVID early on, like patients had to do it, and patients had to come together and produce research and educate each other on what was happening. And now we're doing that still, but now more researchers have been brought on board, and there's more funding available, though still not enough and not going to the right things necessarily, but there's still funding available for other research to get involved.
It's probably a good point also, just to sort of differentiate that, when we say long COVID, we really probably are meaning a lot of things, and it's probably good to at least just say that for some people with long COVID, there are very specific reasons that are identifiable for their symptoms, if it's related to organ damage, or if they have ICU syndrome, or if they have other specific things that are identifiable. But as we know, what we're talking about a lot of what we're talking about is the cluster of patients, which is of a significant size, that have these kind of non-specific symptoms that are hard to pinpoint what's causing them. The cognitive dysfunction, the relapses, post-exertional malaise or symptom exacerbation, the respiratory, some of the respiratory issues, and so on. So those are the ones I think that people often are thinking about when we talk about long COVID as kind of a group. But probably many people have a bunch of different things going on. So it is definitely a heterogeneous group of people.
Absolutely. And I just want to call out that we're talking about ACT UP and we're talking about HIV/AIDS, but I think we're pulling from so many different threads here, and obviously MECFS advocacy efforts have been crucial in the organizing work that long haulers have done. And Padma, Priya, I'm wondering if you can talk a little bit about what you mentioned in terms of like post-viral illness solidarity in South Asia and what you've come across.
Sure. I think I'll start by saying how, I mean, I sort of grew up seeing a lot of the HIV/AIDS campaigns being launched in India. That's some of my earliest memories linked to public health was about that. And in my undergraduate, we had formed these peer support groups to talk to each other about, sexual health and, about creating awareness about sexual diseases. And not a lot of people obviously signed up for it. I'm saying obviously because it's a very cultural thing for us. And I remember signing up for it, and I found that the work that you can do as just a peer support, even so, I was basically trained to just talk to people about sexual health and sexual health diseases, and and then slowly, girls would. I was studying in a women's college, so slowly young girls would, of my age group, my peers would walk in and ask me these questions, and I realized the importance of that. So I think for me, that's my earliest sort of foray into peer support. But I think my biggest sort of revelation about how important that was actually came when I started working with Doctors Without Borders, and they have a they are very particular about being patient-centric in their approach with medical care, and providing peer support is one of their key arms, especially when it comes to diseases like tuberculosis, which is India has a high burden of tuberculosis, and is also a very devastating disease, and it takes over 2 years to treat it. And then there are India also has a high burden of multi-drug resistant tuberculosis. So I saw firsthand how these peer support groups, between patients, were actually helping them adhere to the treatment, helping them, make sure that they're eating well. So they would support each other, they would pull up each other, they would, scold each other for missing medicine. So it was a very sort of learning experience for me, that sort of peer support, and then the advocacy that they did for themselves and for others around them about the disease, about getting the right kind of medical care. So I think my perspective is very different from Lisa and Fiona's. And the other thing that has happened that I mentioned also in the book is that there is a history of post-viral illnesses in India. And there are a couple of studies that have happened, say, about post-viral dengue and post-viral chikungunya. There are some researchers who have actually gone into it, who have actually looked into it, and have done their bit in sort of trying to create awareness about it. So I sort of pulled in my, I think my chapter from my experiences from all these different spaces, and I wrote that chapter. But yeah, I think like for me, it is very critical to have that sort of patient-centered and patient. Any research that has to be grounded within patient experiences. I think it's really good if a researcher starts by talking to a patient, and then sort of figure out how to build on that research, or how to make that survey better, or how to further it. And I can give like maybe one small example about how my group spoke to my support group that I led to. A couple of them spoke to a research team here in India who are working on a clinical trial and on colchicine, and if that will help with long COVID. And the perspectives that patients gave were really very, very interesting. Like for example, the researchers were thinking about the amount of fatigue that would hit a patient if they were going to a hospital, traveling to the hospital, say 3 times a month or 2 times a month to get the drug. So then we were like, why can't you just give the drug in one go? And of course, there were a lot of back and forth, but perspectives like this came in, and also like, how do you a lot of the difficulty for us here in India also as patients is that and why peer support has become so important here is because we are also not all of us have the support of our families or friends. we don't, or forget doctors, we don't, even like our friends and families have told us to move on, or told us that, you need to just move on with your life. You can't be sleeping all day, or you can't just be, quitting your job and doing nothing and sitting at home. So I think it's in these kind of perspectives that kind of help you sort of frame research, because otherwise it can sort of very quickly get skewed towards is it all in the head sort of a narrative. So yeah, that's my 2 cents on this.
Do you sense, excuse me, in India, are people picking up, following the British lead a lot in sort of medical things? Is there still the kind of link that way, that they would tend to follow British medical thinking and more, as much as American or more than American, or not necessarily?
I think not necessarily. I think this way it was set up, of course, a lot of our laws and everything still actually can, do date back to the British. But and also maybe the way the health system is set up, from, you have the district or the district hospitals, and then districts are like small regions within a particular state. And then you have the state at the tertiary hospitals, and then you have the super specialty hospitals. I think the way they're set up is still a bit how the modern health system came into India. But I think it's not like we follow one kind of system. Perhaps we are, I would say that there is a lot of influence, maybe more of the American narrative in medical care in India, but I'm not an expert on this. So yeah.
And so, Lisa, in terms of your sort of research background, what was it that you were hoping to bring in the chapter? You sort of went through various aspects of research. What was it that you were hoping patients would be able to get from that?
Yeah,
Or
so
for anybody, I guess, not just patients.
yeah, I think my main goal with that chapter was to give patients the tools that they need to read research studies and take information out of research studies that they need to make informed decisions about their own health. And then to find ways to, if they're interested, participate in research, whether by being part of research studies or by being a patient representative and really having influence on the research studies. But I think, the main priority really focused in on breaking down what is kind of like an academic barrier that many research studies have, where, it's not often clear what the results are, or that some results in a research study may not be in the abstract, but are buried, and that,
Right.
still like in the study, but you might not know to read the full thing. And to be aware of some of the real downsides of research studies. I think there's this perception that if a study is done, it's done well, and that we can trust it. And what we found with ME/CFS, with long COVID, with literally any research study, but especially in these illnesses, is that often the methodology is not great, and we can't actually trust the results to be reflective of what my experience is, or what another patient with long COVID's experience is. So, an example of that I point out in the chapter is this reliance on people who had a positive PCR test, and knowing that that excludes a huge proportion of people with long COVID, knowing that, that research study may not actually be representative of all long COVID patients. So trying to teach people to think critically when they're reading through these research studies, because too often we don't have that translator of this research. A lot of times academia really just, it's like an echo chamber within academia, and research studies aren't written for the people whose lives it actually impacts. And so trying to, in the meantime, since especially now there are, thousands of papers out there on long COVID, enabling patients to really be able to look at a research study and identify if it's going to be helpful for them in their health journey.
So a couple of things that really irritated me at the beginning when there was this initial start of long COVID, because there were a lot of stories, or at least a number of stories in the fall of 2020. That was when the first wave, of the stories, and then they were being criticized because your study, the body policy study, was being cited, and most of them didn't even have positive COVID tests. Without actually some of the criticisms, without mentioning that people couldn't get COVID tests. I mean, there was a reason people didn't have COVID tests, and it's not really, that was being sort of portrayed as kind of a fault of the research as opposed to a fault of the medical conditions that were set up so that nobody could get a test, and that should not be used to dismiss the reality that people likely had COVID. And the other thing that bothers me is this use of not just the PCR test. I mean, that's the problem with using the PCR test. You couldn't get a positive PCR test at that time, or it was done too late. But the use of just the serology tests, the antibody tests, to show that people without positive antibody results at some undefined point in time after they thought they had COVID, and they compare that with those who have positive antibody tests, as if those tests are really dispositive or really completely tell you, the rates of inaccurate results from those are big enough to skew the findings. And it may be that people with long COVID have worse antibody results and are less likely to have antibody tests, that the association actually suggests something that you're denying it suggests. So it sort of drives me nuts, some of these things, when I see them.
Yeah, absolutely. And that is the case. I mean, we've found that people with long COVID are less likely to have antibodies. Women are less likely to have antibodies. Children are. So we know that that's not an accurate way to determine whether someone had COVID. And that's grounded in many research studies at this point. And so it's not good methodology to base your research study off of an antibody test.
Right. So let's see, we have about 20 minutes left. Are there things that we haven't brought up that any of the three of you want to make sure to bring up? And then we can see if there's any particular questions from people listening.
Well, one thing I just wanted to say about Lisa's chapter and sort of what it aims to do is, and why we wanted a chapter like this in the book. Patients are reading research. Patients are attempting to read and understand emerging research. That is just happening kind of regardless of whether or not a group like patient-led research exists and whether or not a book like this exists. And that has been going on for decades, is gonna keep happening, because when you have, especially when you have a disease that is newer or is under researched, whenever there's new findings, you want to be looking at that and seeing what's going on. And there is something that has changed as a result of COVID, and maybe this has happened in the past when there's kind of an explosive public health issue, which is also that journalists there are journalists covering research studies that have not necessarily covered this type of research before, or that are not even science or health journalists some of the time, right? And that's a result of kind of this explosion of pandemic news coverage, where you have people kind of addressing this from all angles. So I mention this both because I think part of the reason we wanted this chapter was we wanted to give patients the tools, knowing that they are out there sharing these studies in support groups, or these preprints in support groups. We wanted to give them the tools to accurately, or more accurately, assess what they're reading, to kind of try and get a handle on some of the misinformation that can float around. But we also wanted to empower patients to be able to not have to rely solely on mainstream media to understand what's happening with emerging research, because unfortunately, sometimes the studies that media publications choose to focus on, sometimes they're choosing because something sounds exciting and they think their readers are going to be interested in it. And far too often, I think patients find themselves in a situation where we hear a healthcare provider, certainly a family member or friend, is saying, well, I read this article in, let's say, New York Magazine that says that exercise is really the only way to get rid of long COVID, right? And it cited studies. And so we want patients to be able to have the tools to, even if in that moment they can't kind of recall what exactly is wrong with that study, to at least be able to go home and do the research and kind of understand whether or not they actually agree with that study. So
I think one of the important things to bring out in this whole debate also is just to highlight the role of the symptom that we either call post-exertional malaise or post-exertional symptom exacerbation. which is kind of counterintuitive and I think has caused a lot of confusion because basically, just to clarify, the name chronic fatigue syndrome, fatigue has always been a bit of a misnomer here. It's not fatigue like I went to the store and now I'm tired. It's like sort of, kind of what I would describe, people describe it as a somewhat paralytic exhaustion or just really just absolute inability to move pretty much. And so fatigue has been, and that the main symptom isn't sort of fatigue per se, but it's this disproportionate relapse or exacerbation of multiple symptoms, not just being exhausted, but of all the symptoms after a minimal amount of exertion. So I think a lot of the research that I saw, especially early on, and some of it still seems to sort of not think of it that way, just like a lot of the ME/CFS research sort of tends to sort of not necessarily, especially the earlier research, not think about that symptom and interpret relapses in a somewhat different way as a function of deconditioning and not a function of actually ongoing issues. So I think that's one of the big mistranslations that happens, both in some with the new researchers doing long COVID who didn't think about any of this before they started doing research and didn't actually realize that this PEM or PESE or whatever we're going to call it is a big factor in both of these illnesses and needs to be considered when you're implementing things like exercise therapies. That they may be good, but they're not good for people with this particular symptom or this particular tendency to exacerbate everything if you do too much.
Well, even, I mean, I think many of the researchers that are looking into long COVID are, like you said, they're not familiar with post-exertional malaise. And what that translates to is that studies are set up so that they don't account for post-exertional malaise. And so, where people are collecting blood samples at just any time, where we really should be collecting samples when people are going through PEM or experiencing post-exertional malaise, when they're not experiencing post-exertional malaise, acknowledging that that exists. If you're doing a study where someone has to come into an office knowing that that could cause post-exertional malaise after, it translates into then accessibility of these studies for patients. So yeah, I think the misunderstanding or just like lack of knowledge of post-exertional malaise and ME/CFS generally throughout our medical system has resulted in a lot of harms and studies that aren't well set up and aren't going to come to answers as quickly as they would if they incorporated that symptom.
Mhm. Padma, how is the awareness of post-exertional malaise or post-exertional symptom exacerbation in India among medical professionals and among patients that you in your support groups?
At least from my own experience as a patient and as someone running the support group, the awareness is not very high. And in fact, like what you just described it is perfect, David, where you said it's almost paralytic exhaustion, right? You're paralyzed. You want to move, but you cannot move. And all you can do is just lie down and just sleep. And fatigue just doesn't even come close to describing it. So not a lot of people get that here. Not a lot of people understand that here. And so I think that's part of why there is so much of struggle to get access to good, to get right medical care, because we do have really good medical, professionals here. But I think not everyone is equipped to understand PEM. Not everyone is equipped to even understand CFS. It takes months for patients to even get a diagnosis for CFS. So yeah, I think the awareness definitely has to go up among patients. I have seen that it is higher because, like Fiona and Lisa said, our experience is that we want to understand what's happening with our body. So we go and start reading up, and then we're like, oh my God, these symptoms sound exactly like what I'm going through. Is this what it is? And then they join support groups, and then they're asking, and they're sort of sharing their symptoms, and then they're asking, do I have PEM? Do I have CFS? And I'm not a doctor, and as a peer support group, all we can do is offer resources. But at the end of the day, they also need a diagnosis, or they need some sort of paperwork so that they can show at work, right? And a lot of the times when doctors don't know about it, there is a multiplier effect to this issue, which is that often employers don't understand it, and then after a point you have to let go of the job or you're fired. And so I think it obviously has deeper impact than, then apart from research, there is a whole economic and social impact that it causes. And, definitely needs more awareness, needs more conversation, needs more education within even the medical establishment, I feel.
Okay, thanks. I wanted to say, let's see, I don't really see any questions. So people, if anybody wants to sort of pose a question, I can see if they're here. One person did write about the your New York Magazine article, that it seemed like the writer in the New York Magazine article was trying to show both sides as if they were trying to find a middle ground. You know, I would not say that exactly. I would say that he made an effort to show that he was trying to show both sides, but it wasn't a very good effort, because I think what he portrayed was not an accurate representation of the science. And I think that the story really came skewed pretty much heavily on the side of the people who were pushing were the the kind of cognitive behavior therapy and graded exercise therapy. He seemed to come pretty hard on the fact that he thought the science was valid, and that the authors, at least as it concerned the PACE study, there was one paragraph involving me and my work on PACE. He misrepresented my work on PACE and my objections, and then basically gave the PACE authors the last word and said they responded and said their results were solid. So I guess if the PACE authors say the results are solid, it must mean that's the case. So that was my takeaway from the article. I didn't think it was, it made an effort to look like it was giving both sides, but it really wasn't in the end. It was very skewed towards one side.
I think the person, I think Georgia is saying, it was Georgia who added that comment, right? I think she's saying that, that yes, that the person was sort of like playing into a bit of like a false both sidesism of
Okay.
like trying to represent basically, two sides as equivalent that are like a false equivalency between two sides that are not in fact equally
Okay, then I misunderstood. Sorry, Georgia. And Georgia's right here. Yes. So Fiona interpreted her correctly, and I misinterpreted her. So I apologize for that. Thank you for clarifying that.
I actually had a question for all three of you, which was, I'm curious, it's kind of a, an either or question. If there's either a recent, study or preprint or something that has come out that you're especially interested in or excited about, or if there is a specific type of study or clinical trial that you would really like to see done, what that might look like with regards to long COVID and, related illnesses.
Well, I'll say one thing. Lenny Jason did a study that was about MECFS, but where he looked at patients coming, it was sort of a cohort study, but it was a cohort study that began before anybody ever got sick. So it was patients entering college and who got mononucleosis, and then of the ones who got mononucleosis, which ones then had a diagnosis later of MECFS, and they had data from before any of them got sick, so they could see what the differences were between those who later got sick and those who, they stayed sick after having mono and those who didn't. And I think that they're also using that same cohort for long COVID. So it would be interesting to see if they get any results from, or a study like that where you have, because one of the problems always is if you start taking data just at the time when people are sick, even the psychological data may not reflect how they are before they got sick. So it's good to have longitudinal studies with some data sets collected before anybody got sick and then see what happens later. So studies like that, I think, would be interesting to show what is different between the people who stay sick and those who don't.
I'll say for me, I'm really excited because tomorrow our PLRC, Patient-Led Research Collaborative, is announcing that the grantees for the Patient-Led Research Fund, $8 million research fund into long COVID, MECFS, and associated conditions. So we have 9 grantees. So that'll come out tomorrow on November 22nd. So very excited for those 9 studies. And then I would also say, I know David Petrino has a lot of great stuff going on, but one of the things I'm really excited about is that he's looking at menstrual cycle impacts on long COVID. And I think that is an area that has been neglected for far too long, and really needs to be embedded in every research study, but at least we have one that's focusing on it.
What was that about impacts? The
Menstrual cycle impacts
menstrual cycle
on
impacts.
long
Okay.
COVID. Yeah.
What are the
So I'd
potential,
say that's
what is the
one.
thinking about menstrual cycle impacts of long COVID?
Well,
But go ahead.
no, I was just gonna say, well, there's a whole chapter on it in the book.
Yeah, there's a
Go
whole chapter
ahead,
on it.
please.
Yeah. But I think the patient experience with it is that, either the week before your period or on your period, you have an exacerbation of symptoms, either new or, the same ones. I have developed premenstrual dysphoric disorder as part of my long COVID. That can be a common thing, as is developing perimenopause, a variety of menstrual impacts that have really been, not super talked about. So I think it's something that really needs to be focused on. I mean, most long COVID studies I see don't even ask about these symptoms or ask about these types of outcomes. And it's a huge issue that we're facing.
Yeah, I mean, I'll say that actually is has been the most substantial long COVID issue in my life since like September of 2020. Like I most of the other issues like resolved to an okay point, aside from the menstrual issues. Were you gonna say something similar?
Yeah, I mean, I think it was definitely really looking forward to more research on menstrual cycle and long COVID. But I think the research that I am really excited about is definitely the microclots research that's coming out from South Africa. And I hope that expands because, to other countries also, because I do feel like that there is something there. I know that there's one person from our group who tried to get it done in India, and it was really difficult to get it because it's not easily available, the test. So I hope that there'll be some sort of diagnostic outcome, so that it becomes easier to test for microclots and to actually look into that theory. But also there was a study on neuroinflammation and how that is impacting people cognitively. So I think more research around that would definitely be of interest to a lot of us.
Where do you see, I'm sorry, did I cut somebody off?
No, go ahead.
Do you see, Fiona, do you see a follow-up to the book? I mean, what comes next? Sort of the book's out, so now what?
Well, I think we have some events planned with colleges in the spring. And I'm actually really eager to try and do more events with schools, specifically colleges, because I feel like college students are at especially high risk of long COVID because there are so many reinfections happening. And there's just not a lot of information getting to those students. I mean, I'm 28, so I'm not that far out from that crowd. And I have some friends that are still undergrads and we're talking about this. So I'm hoping that we can just do more speaking tours to kind of get the wisdom from this group and from this book out more generally. So we're doing more library talks and more college talks. And I will say again, just if anyone's on this call and can request the book at their local library, that would be hugely appreciated because that is a great way to make the book accessible. But beyond that, that's a great question. We've had a couple people, say, in future printings, could it be updated with more information? There's certainly a part of me that feels like if long COVID truly ends up being as impacting as we think it is, and as I think we all believe it is, maybe this will be a sort of our bodies, ourselves type book that does get updated, for each generation. Or I believe this book, it's called the Long COVID Survival Guide, but I do believe it's a survival guide for a lot of chronic illnesses, and in many ways for anyone who has dealt with a complex or novel illness that, you have to navigate healthcare systems for. So I'm hopeful that we can kind of, maybe have expanded editions one day. But I think I talk about this book a lot as like a lifeline in the interim while we wait for, better treatment and hopefully eventually a cure. Unfortunately, I think, if the HIV/AIDS story teaches us anything, it's that many of the lessons in this book will remain relevant even after, a potential, treatment is available, right? Because we know that there are preventative treatments available, and there are, antivirals available for those diseases, but it's not accessible to everyone. People are still navigating biased healthcare systems. They're still needing to understand disability benefits and financial issues and accessing caregivers and all of the type of thing that's in this book. So
And the human species doesn't really learn much from experience, I've decided. I don't think we're really very good at applying past experience to current realities. That's just my impressions. Well, what do you think about just this the role that long COVID has played in calling attention, well, to ME/CFS and just post-viral illnesses as a whole, which have been, as people say, neglected, even though, again, people with, in the ME/CFS world knew immediately that this was likely to have this long, this long hauler wave. We didn't, without having the name to call it anything. Have you seen, what do you think about that sort of phenomenon, about how much attention this has brought to that, these prior illnesses that people have suffered from?
Padma, Priya, did you want to say something? So nodding.
Yeah, I mean, I think, so I think there's definitely, I think there's two, for me, like what I'm seeing at least here is that there is definitely the connections are being made by doctors. So if a patient walks in and if they have had prior experience in treating post-viral illnesses, so if they're an infectious disease specialist, an internal medicine specialist, or so on, then they immediately do make the connection and they say, yeah, this has been caused by COVID and here's what you can do. But for me, what's frustrating is that it's not really leading into any sort of research coming out of India. Like for me, I feel like if India does one, even if India leads the way in doing a national prevalence survey, which has not happened, even a prevalence study would actually lead to more discussions on other post-viral illnesses. And the fact that this has remained so neglected for so many years is very disheartening. So, but I do feel like there is more conversation happening, at least among like more health journalists being aware about it, writing about it, more doctors sort of waking up to, oh, like this can actually have severe long-term impacts. And definitely those who were very senior doctors who were part of the HIV/AIDS movement have chimed in and have said that, we need to sort of look into this deeper and there needs to be more conversations about it. So yeah, so it's happened in this way, but I also sense a lack of curiosity or and frustration also among the medical experts, because one, there is a lack of resources. We don't have the kind of resources that other countries may have, whether to carry out a research study or nor do they have the time. So they're really stretched for time. They don't, the kind of load that they see on a daily basis is really high, the patient load. So, and it's so different from other countries, right? So, yeah, and again, like I said, there is, like every doctor I go to and I speak to, and if they're saying that, yeah, we're seeing a lot of patients with, say, inflammatory arthritis or, severe spinal issues post-COVID or menstrual issues, and then I ask them, are you, is there any research happening in this? Do you know of any doctors who are doing anything in India? And they're like, we would like to, but where is the time? Where is the money? So I think that's definitely a big issue about time and money. And I think some amount of push has to come from the governments, different state and the central governments. And, I do hope that this will happen eventually before it's too late. So.
Okay, I hope so. Any last thoughts? Lisa, we were talking a lot, but you didn't say anything in the last few minutes. You want to add any final thoughts here?
Just I'm excited for hopefully the response to the book. I'm very hopeful that it'll help a lot of folks. I wish that we had this book when we got sick. And yeah, I think in terms of long COVID research moving forward, I think we have a lot of great people that are working on this, but we need to keep the focus on the patient experience and really incorporating the patient voice into research studies and making sure that the results are accessible to patients. So I hope we don't lose sight of that, and that we make sure that patients are really at the center of the response to long COVID and ME/CFS and other related illnesses.
So I think that's a good note to end on. I think we can probably all agree with that. So thanks. I think, Fiona, you'll have a recording of this, so hopefully we'll be able to get that up fairly soon, and I'll put it on Virology blog as well as on social media, and I'm sure you all will too. So thanks very much. This was fun. I enjoyed it. And I'm looking forward to seeing how the book does, and hope it really has an impact.
Thank you so much, David. Thanks for having this conversation with us.
Okay, thanks. Bye.
Thank you.
Everyone. Bye.